I was always interested in medical shows. I don't know, I remember Emergency was a show I liked to watch, and I had no one in my family was in the medical field, but it was just kind of a draw I had to it. Then as I got later on in high school, I kind of thought I didn't want to do it. I thought, you know, I had some crazy idea I was going to be a stockbroker in New York City. Like, I was from a very small town, not too far from here in Taylor, Texas. And so as a summer job before I started college, I started working in my family practice physician's office, and I just loved it. So I went back and went through drop ads at Baylor University and became a pre-med student, dropped the business classes, and here I am today. My goal was always to get a healthy mom and a healthy baby. And I know being a parent is, for myself and my husband, was a life-changing event. And I feel very honored that I'm able to help a woman through this part of her life. I've been pregnant. I know how it feels those last few weeks. You've got to grind and get through it. You don't always feel the best, but it's not forever. And also I know how concerned and worried you are for your unborn child. And even after you have it, that postpartum period can be very trying. And I think, you know, I understand the aches and pains of just a normal pregnancy that you experience, and I'm able to relate to them and say, you know, I know how that round ligament feels, that pain feels. And I said, you know, if I didn't know what it was, I'd be calling my doctor too. Anytime patients have a list of questions and they feel insecure about something or they're very concerned, you know, we go through them all, we address them. I always make sure that they feel comfortable with what their questions, that was answered appropriately. I had one patient one time, something that she said, and I've always kind of taken it to heart. One of my moms said, you know, that's Dr. Jansky, and she's the first person that's ever held you. And I've kind of always held that close to my heart, and I kind of took note of that, and I said, you know, that is true. And I really am blessed with that honor and the responsibility that I have with that mom and her child, and getting her through the pregnancy, and looks like a healthy baby, and everything, you know, turned out okay. And you know, that is a special thing that I've been blessed to be able to do. And you know, I'm sure I'm in a lot of family photo albums that I don't look the most glamorous or flattering, because you know, babies come not always during the daytime, so I might be getting up in the middle of the night and you know, probably not taking the after delivery shot looking the best. But that's something I think about too, that you know, I'm always I have a little bit of me somewhere in that family. Things like that, I guess, occur in your life for a reason.